What is the difference between tendinitis and tendinosis? Let's find it out. In case of tendinitis, the biopsy of the tissue would show inflammatory mediators.
अरे भाई पहले ये तो बता टेंडन क्या होता है.
A tendon is a fibrous band of tissue which connects the muscle to the bone. To give you an example, look at this mouse. Imagine the body of this mouse to be the muscle belly and the tail is the tendon which connects the muscle belly to the bone. Now let's look at the actual difference between tendinitis and tendinosis. Who? Aha. Okay, so tendinitis. Itis signifies an inflammatory process. You might have heard terms like spondylitis, myocarditis, and tendinitis. So spondylitis. Spondy refers to spine and itis is inflammation. So spondylitis is a condition where there is inflammatory changes in the spine. Same in myocarditis, there is inflammatory changes in the myocardium, which is the heart muscle. And in tendinitis, there is inflammatory changes in the tendon of the muscle. Whereas in tendinosis, osis refers to an degenerative process. You might have heard terms like spondylosis, which is an degenerative process of the spine. Tendinosis, it is a degenerative process of the tendon. So that is the one difference between tendinitis and tendinosis. Second, it is usually because of any trauma. The trauma can be an acute sudden trauma or repeated micro traumas. Whereas in tendinosis, it is usually because of overuse. In case of tendinitis, the biopsy of the tissue would show inflammatory mediators, whereas in tendinosis, the biopsy of the tissue will show degenerative changes and no inflammatory mediator. There is also something called tendinopathy. To know more about this, read the description below.